Of course, you must have been hearing about this resurgence of new cases in some countries, even in countries that we thought that were already safe and had things under control. So what does this tell us?
Actually, it's the same story that we have been discussed all along. That it is not easy. I mean, to eliminate the virus from any countries, since it is very infectious. So there is a chance, always there is a possibility that the disease will come back. But hopefully, if the countries prepare itself very well, the country may find some cases, but hopefully they can control it very quickly. So there is no widespread epidemics within the countries that start to see the case coming. That is something that Thailand is trying to do as well. We always say that one day found we may find new cases again, but hopefully we can control it quickly. So having no case in the countries is not realistic goals. Finding the new case is always possible, but hopefully we can control it.
Do you think we should be scared of the COVID-19 second wave in Thailand because neighboring countries seems to see the resurgence of cases such as in the Philippines or in Vietnam?
I don't think we should be scared. What we should be is that we should realize and should understand that there is a chance that we will find a new case. But and one thing is that we should keep in mind is that we have been able to control it once. We knew how to do it, and I think if it's happened, we can do it again. And the issue will be that during these times, we have to have the mind open our mind that the case may come back. So instead of worrying about it or scared about it, I think what we should do is we should review what we did last time, what we did to ourselves, what we did to our family, to our office, to our societies as a whole. Then think about it, and then when start to get worse, and when we start to see new cases coming, we should be prepared on applying those knowledge and act in the way that we should do. And there should not be any panic, and there should not be any overreactions again, because as I mentioned, we have been through the situation once, and if we keep calm, I believe that we can do it again.
But do you have any idea what went wrong in these countries which saw a sudden resurgence of new cases? Something we can learn from them?
There are a lot of things that we can learn from our neighboring countries. One thing that we have to keep in mind that there is no two countries that are exactly the same. The situation in their countries is not the same as in our countries. So if we learn something, we should ask ourselves, can we apply that to our countries? And then how should we make it better? For example, the outbreak back in Hong Kong, most of the parties speculate that it was because of Hong Kong has opened up the country quickly, and they also have the policy of quarantine everybody for 14 days, but they have so many kind of quarantine. Some is quarantined by the state, some of the quarantines run by the private, and some just they also have some home quarantine. And because of those policy, and when someone who should be quarantined, they are not quarantined well enough, then the disease starts to spread from one person to another, and then after they know what happened, the disease has already spread very quickly. Nice. So quarantine is very, very important, and we should stick to our operation procedures, and we should follow whatever we think is best for us. In other countries, for example, in Vietnam, um, when they found the first case of their second waves, the case visited the hospitals, and there were an outbreak within the hospital. So many staff and so many patients got infection from the index case, from the first case. That's also tell us that if we have the situation, if we found the second case, or if we have the local transmission once again, the first case of the local transmission is very likely to be diagnosed and very likely to visit the hospital as well. So the hospital will be the breaking point. So that's also tell us that we should also keep doing what we have already been done. That is having a strict infection prevention in the hospitals. We have done quite a good job during the first wave, so we should continue to do that, and we should continue to do it today as well. In preparation for the second wave, it's very important for every hospital, private or public, that they should be aware and should keep their infection control programs running at the very high standards. Those are the lessons from Vietnam, and I think there are also so many countries that probably change strategy a little bit. For example, in Japan, they open up very quickly. They don't even have the zero case report yet, and they start to reopen their countries. In the first wave, they have a high number in death as well. So what they did differently in the second wave or during this time is that they prepare more hospital bed than the first wave. Although they have a lot more patients in second wave, but if you look back, you see that the occupation rate of the hospital is still very low, less than 50%. So they have a lot more bed for the patients. And the second things they did differently was that in the second wave they protect the elderly very well. So during the second wave, if you look at Japan, there's a lower number of deaths when compared to the first wave. So that is how they apply what their mistake was in the first wave to the second wave. And for the second wave, if you look closely, you will see that Japan did not really close down or lock down that as strict at the first time around. So to me, every country learn from each other, learn from themselves, and then they adjust their strategy accordingly. So that, for example, Japan, if you look at Japan today, although they still have cases, but they are not as worried as the first time around as well. So there are so many things. If I can go on and on.
No, but Dr. Tanarak, the next challenge for Thailand is that we are opening up the country for more foreign visitors, right? And in fact, there are now thousands waiting to enter the country. So what do you think we should look out for in particular?
At these times, although we have a lot more foreigners coming in, but still we quarantine everybody and we quarantine them very strictly. We have 3 types of quarantine. We still do not allow anybody to quarantine at home yet. We quarantine them at the quarantine site that prepared by the central government. We have what we call alternative quarantine site. That is the hotel that if anybody who don't like the quarantine site that the government prepare for them, they can pay for themselves, and then they can stay at the probably more luxuries, larger rooms. And the third type was what we call organizational quarantine. That is for the migrant workers that we saw in the 6th phase of open up. So we still have the quarantine, and we have the ways that each the government and the hospital, private hospital, can come in and check for the qualities. So we have double and probably you can say triple check for the quality of the quarantine site. Um, and the numbers of travelers coming into the country is still limited by the quarantine site that we have. At the moment, on average, we have roughly around 500 to 700 um, travelers to come in. Those mainly are still Thai people, but there start to be some. We start to see some of the foreign citizens that arrived in the country as well. So, um, as I mentioned earlier, and every time when I say this, is that um, it is not the risk that we should consider. It is if there is the risk, we should consider on how can we control those risks or how can we lower those risks. So we know that incoming travelers from internationals can have high risk. The issue is that how high the risk we can handle, and I mean how can we arrange the intervention so that we can lower those risks to the levels that we feel satisfied.
No, but opening the country to tourism, is that something that you certainly want to have some caution about?
Yes, of course. If we want to open up for the short-term travelers, then we need to prepare ourselves very well. There are so many steps that we have to take, starting from what countries we should allow to come in, and what province or what site or travel site we should allow international tourists to come in, and how can we build what I will call the virtual barriers that can protect most of the Thai people from get infection in case that international tourists came in with infections. So those kind of barriers, New Zealanders call it the bubbles.
Yeah.
That build the barriers between most of the Thai citizens and the tourists. Of course, there will be some of the Thais who need to involve or need to come into close contact with the tourists. But how can we limit the numbers, and how can we make sure that we can detect the infection as soon as they got it? So if we can do all that, I believe that we can probably start to pilot bringing in some of the international tourists to test our system. But to me, we like to mention something about short-term tourists. That is, anybody who want to come in and want to stay for less than 14 days. But I think it should be more beneficial if we open up for more long-term travelers or long-term tourists who want to come in and stay in Thailand for longer than 14 days. Those will be more beneficial and easier to manage than the short-term tourists. I mean, we may have some limited times for them so that we check them that they have infection or not. During that time, they may have they can travel, but they cannot travel far. I mean, they can travel within the limitation or within the rules that we set. But after 14 days, they can, probably travel wider. And since 14 days usually is the longest incubation period that we have. So, there are so many options and there are so many ways that we can do it. As I always say, if we can lower the risk of the virus spread to the level that we feel comfortable, then I think we can move on and test it.
All right, Dr. Tanarak. So your message still is don't panic, but don't lower your guard, right?
That's right. There are two extremes of thinking. One way is that, well, we don't have any cases, so why worry? Let's go out and have some fun, and we don't have to wear masks anymore. In that sense, it's kind of fine. But what if there is a case arrived in the countries? Then if we are not aware, or if we are not careful enough, when the first case comes, just like in Vietnam, just a few cases that arise, then we start to see a lot more cases. Now I think more than 200-300. If you look at the numbers and look at the impact in terms of how long they need to control it, instead of needing just about a few weeks, now I think it will take more than a month before the Vietnam can declare that they're virus free once again.
Oh, wow.
So by working by staying alert and careful, I think that we can avoid the large scale outbreak by practicing these universal precautions.